Hello,
Hi.
my name is Brandy and I'm going to be your nurse today. I'm going to pull this curtain for some privacy. Can I have you verify your name and date of birth for me?
Yeah, it's Brianna Poulter, April 1st, 1993.
Awesome. Okay, do you have any allergies that I need to be aware of?
No,
No allergies? Okay. Do you have any cultural differences or religious beliefs that I need to take note of?
no, I don't think so.
Okay. Well, right now I'm going to do an assessment and check all your vitals for you. We'll be checking your cardiac and your respiratory today. There will be some moments where I have to expose your chest for some of these assessments. Is that going to be okay?
Yep, that's fine.
Okay. At this moment, I would note that the patient does not seem in any distress, that she is well groomed and kept, and that she is clean and appropriately dressed for the season. She does seem cognitive and not blurring any speech, slurring speech, and that she seems alert ×4 and oriented to time and space. I'm going to raise your bed for easier level to perform the assessment. Are you doing okay?
Yeah.
First thing I'm going to do is get a set of vitals on you. I'm going to check your temperature with the temporal. And you're at 98.6, which is good.
Okay.
Next thing I'm going to do is check your blood pressure. And while I get your blood pressure, I'm also going to check your oxygen saturation on this other hand. If you'll just wear that for me. Okay, it's 118/72. That is good and within normal range. Now I'm going to check your pulse, your radial pulse. Alright, so your pulse is 66, which is good, and your respirations are 18, which is normal. And I show that your oxygen saturation was at 99, which is good. And I'm also making note that you are breathing with room air and you're not using any oxygen supplements such as a nasal cannula or anything. How are you breathing these days? Are you having any problems with shortness of breath, or when you breathe deep, or is there any anxiety?
No.
Everything is good. Have you been having any pain in the chest or any pain anywhere?
No, not really.
Okay. Another question, do you have any problems with coughing or anything?
Not lately, no.
No cough? Okay. Well, now I'm going to begin my heart assessment on you. And normally I would not perform this over close, but I'm going to do that for the video for privacy of the patient. So first thing I'm going to do is use the diaphragm on my stethoscope, and I'm going to use the aortic part, which is on the right side at the second intercostal space. Now I'm going to listen for the pulmonic, which is the second intercostal space, left of the sternum border. Now I'm going to listen to Herb's Point, which is where you would hear the S1 and the S2 heart sounds. And you also, it is at the third intercostal space to the left of the sternum border. And now I'm listening to the tricuspid, which is in the fourth intercostal space, which is in the lower left to the sternum border. And now I'm going to listen to the mitral, which is also known as the apical, and that is in the medial to the mid-clavicular line in the fifth intercostal space. Everything sounds good. I don't hear any S3 murmurs or friction rub, which is good. Everything sounds normal. There's no labored breathing or adventitious sounds. Now I'm going to listen with the bell side in the same landmarks that I did before. The aortic, the pulmonic, Herb's Point, tricuspid, and the mitral. There's no labored breathing. I don't see any accessory muscles used when she breathes. Everything is symmetrical, and the chest is actually wider than it is deep. So now I'm going to begin the lung sounds, which again I would not do over clothes normally, but I am going to assess for patient privacy in the video with her clothes on. So with the diaphragm on my stethoscope, I'm going to listen to all 10 points. Can you take a deep breath in for me? Good. And again. Good. I don't hear any adventitious breath sounds. There's no crackles, no wheezing, no stridor, no friction rub. Her stomach moves symmetrically and equally bilaterally. Again, no labored breathing. Now I will actually, for this video, have her sit to the side so you can see me assess the back part of the lungs. But normally I would not ask a patient to remove herself from the bed. Could you take a deep breath for me? Good. Again, no adventitious breath sounds. Everything on the posterior side sounds good. Now I'm going to palpate on the back side. Could you please take a deep breath? Good. So when she took a deep breath in, her chest wall and my hands raised normally and symmetrically together. There was no labored breathing, and everything is normal for lung expansion, so we're good there. You can get back in bed now. I'm going to make sure the bed is at 30 degrees. And I'm going to check for carotid pulse. Could I please have you turn your head to the side for me? And you never want to check both carotid pulses at the same time. The rate and rhythm and the regularity is good. It's +2, not bounding. Now I'm going to also assess for JVD. But before we do that, I do want to listen for bruits. So I'm going to turn my stethoscope to bell and listen for bruit through auscultation. Can you take a deep breath for me? Good. No swishing there, so everything is normal. As I'm looking, I don't see any JVD for jugular vein distension. Everything is good. How are you feeling right now, Miss Poulter?
Good.
Okay. Overall skin assessment, everything is intact. There's no lesions, no masses. When I check up here, there are no bony prominences or masses at this time. You feel okay?
Yeah.
All right. I'm going to check for cap refill. Both hands seem to be within 2 to 3 seconds. Our radial pulses are symmetrical, normal rate and rhythm, +2. I'm checking for skin on the lower extremities. Skin color is normal. There's no pitting or edema. Hair follicles and hair is normal distribution. I'm going to assess your dorsal pedialis. I hope you don't mind if I take off your socks, ma'am. Alright. Your dorsal pedialis, your pulse is normal with rate and rhythm regular, +2. Your posterior tibialis, rate and rhythm is normal and regular and +2. You doing okay?
Yeah.
All right. I think we have finished everything that we needed to know for your assessment. Is there any questions that you have for me at this time?
No, I don't think so.
Okay, I'm going to make sure you have your call light, and I'm going to lower your bed down for safety. And I'm going to perform some hand hygiene, and I will document all the findings for the doctor, okay?
Okay.
If you have any questions, just let me know.